Hi guys, my name is Mursi. Welcome to my channel. I'm super excited for you to be here, and in this video I'm going to continue on my UWORLD concept series. So specifically I'm going to be talking about Kawasaki's. So Kawasaki's disease, it is not kwashiorkor, so know the difference. A very highly tested concept, so it's really important to know both in step 1 and step 2. Step 1, it asks more of diagnosis, whereas step 2, it asks more of the treatment and next step. In the vignette, basically what they're going to give you is a patient that is less than 5 years of age and they have had fever for 5 days. That is a huge hint. 5 days of ongoing fever, spiking fever, high fever. Okay, I'm being dramatic. So no, but that's a huge hint. So as soon as you get that hint, you know this is Kawasaki's. So as soon as they say that, they'll also give you this rash in the trunk, and it's like a blanching rash, and it's non-tender. They're also going to give you mucositis, so it's just basically around the lips. You have these lesions and on the tongue and the mouth, but not in the pharynx, so you don't have it in the back of the throat, so it's not going to be thought as possible sore throat. And then you also have conjunctivitis, but there's no discharge or anything. It's just redness within the eyes. We already said 1, 2. Oh, they have also lymphadenopathy, so that's 3. And then we talked about the rash, that's 4. And then the 5th one is going to be swelling and redness of the palms and soles, so that's 5. So out of those 5, 4 has to be seen in order to say a full diagnosis along with the fever. So 5 days of fever, and then 4 out of 5 of what I've just listed. But if they have 3 or less, then you want to do a test or check their inflammatory markers. You're going to check for C-reactive protein or ESR. You're going to get those two are inflammatory markers. You can just get one and then check to see if it's high, because it should be high in someone that has Kawasaki's. When with Kawasaki's, they are going to not necessarily have all those 5 symptoms together simultaneously. So that's why if you have suspicion that they have it but they don't have all 4 or all 5, then we're going to go ahead and check the inflammatory markers. And then how do you treat it? You're going to give them IVIG. Super important. IVIG is important for these patients, and that's how you're going to treat it. So my camera died. I had to charge it for a little bit, but I think the last thing I spoke about was the treatment, which is IVIG. Oh yeah, okay, now I remember. So the treatment is IVIG, and it's really important to treat this as soon as you catch it. It's really important to catch it because the complications are pretty damaging. So unfortunately, it can cause myocardial infarction, it can cause stroke, it can cause coronary artery aneurysm, and that's actually the complication that you'll be asked about. Coronary artery aneurysm occurs as a complication in someone that has Kawasaki's disease who's not treated, who wasn't diagnosed properly and treated. So how do you diagnose them? Well, with the vignette, with the history. So they come in with 5 days of fever. They have 4 of the 5, but if they have 3 or less, then you want to get their inflammatory marker levels to see if their inflammatory markers are high, and if they are, this is most likely Kawasaki's. You're going to give them IVIG. IVIG as treatment plus aspirin, because you want to avoid the complication. Coronary artery aneurysm occurs usually after 10 days of having this febrile vasculitis. So because the complication is myocardial infarction, stroke, coronary artery aneurysm, so because these are complications, one of the things that you want to do at the time of diagnosis is get an echocardiogram. It's really important to get an echocardiogram at the time of diagnosis, and then you're going to get it again 2 to 6 weeks after treatment is stopped. So after 2 to 6 weeks of being done with the treatment, you're going to get an echocardiogram again to make sure everything's going good and there's no complications, and then you can kind of chill. It's definitely fatal, so you want to make sure you catch it, and you want to make sure that your patient is being treated accordingly. So let's quickly review. So you have a less than 5 years of age little kid, high fever for the past 5 days, mucositis around the lips and the tongue and the side of the mouth, conjunctivitis, so there's no discharge coming out. They'll have lymphedema, a rash within the trunk. They'll describe it as non-tender, palpable rash, swelling / erythema erythema of the palms and soles. So 1, 2, 3, 4 was the rash that I described, and then 5 is the swelling or erythema of the palms and the soles of the feet. So those are the 5 things. You need 4 out of 5 plus the 5 days of fever to say this is Kawasaki's, or if they have 3 or less plus the 5 days of fever, you're going to get their inflammatory markers checked to see the levels, and then they're going to usually indicate high, and you can say, okay, you need IVIG plus aspirin. Complications, which includes the bigger one that usually gets tested, is coronary artery aneurysm. And what do you want to do at the time of diagnosis? Echocardiogram. What do you want to do 2 to 6 weeks after you've treated this patient with IVIG plus aspirin? Echocardiogram. So I hope that was really helpful. Let me know if you have any questions, any concerns, any thoughts, any future video topics, or specific concept that you would like to go over. Hit the like button and hit the subscribe button, as well as share this video if you think it will be helpful to another classmate. And I'll see you in the next video. Thanks again, and have fun and good luck studying. You got this. Do you want to see my stick figure? Oh, there. That's my stick figure. I pointed at the different regions, so yeah.